Good morning, everybody. I want to say thank you for joining the first of our webinar series. And I want to say a very big thank you to Graeme Dowie of Orbit Communications for leading this morning's session. Graeme is happy to take questions during the session as well. And on the right-hand side of your screens, you'll see a Q&A box where you can ask your questions. So anything at all that you need, please contact Molly and myself afterwards, and we'll be sending you a link with our email addresses. And thank you very much indeed again for joining us this morning. And Graeme, over to you.
Thank you very much. Thanks very much everyone for joining us. It's the first time I've done a webinar quite like this. I hope everyone first of all is well and is coping with the current crisis we're all undergoing. I've tried to ensure my 5-year-old or my dog don't come running into the room a la BBC Family, but we will see if that comes to pass. What I'm going to talk about today, I'm going to try and keep this quite short. I know everyone is very busy, so I'm hoping to talk for maybe 15 minutes or so and taking questions either as we go or at the end as well. So I'm going to talk to you today a little bit about some crisis communications in, I'm having a slight issue because this isn't moving on. Hang on a second, excuse me everyone. There we go. So there we go, that's better. So I'm going to talk a little bit about crisis communications in social housing, how people have responded so far, and also I think critically how that's going to shape not just the rest of the crisis as we go forward, but also how that's going to shape all future engagement for housing associations and indeed a number of other organisations as well. A little bit about Orbit Communications. We are a PR, public affairs and design agency based in Edinburgh. We work with a range of clients both in the housing sector and in food and drink, hospitality and elsewhere. That's just a few of the clients we're either working with at the moment or have worked with recently. So as you can see, quite a lot of experience in both social housing, looking around the care sector, the third sector, and also working for the private sector house builders and associations as well. But I think the first thing to say just on this is the way that housing associations have responded so far from what I've seen both on the work I've been doing for the last couple of weeks and also just from what I've seen has been really excellent. I think there's been a lot of playing to the strength that housing associations have, the strengths you have in the community, the trust I think you have with your residents and staff. And I think those strengths are really going to be critical throughout the rest of this crisis, and indeed I think will show a really good way forward for housing associations in the future as well. And I think for anyone who's worked in communications, I think perhaps a lot of the things you've been saying for a number of years are about to come true, and I think a number of the solutions you've been presenting to others in your organisation are about to be seen for the value that they had. So I'm just going to start with a little bit of basics around crisis communications. This is something I've got quite a bit of experience on working in the past, both in Scotland and also previous roles when I've worked with airlines and governments and how to deal with communications crises as they come up. Some of these are general, but obviously they are designed with the current COVID-19 crisis in mind. But there are some broader lessons, and hopefully would help you guys with other things that come up. The first thing is always in a crisis is think about who your audience is. Who is it you're trying to speak to? Now, traditionally in the crisis planning we do for corporate organisations, quite often the crisis is one maybe not of their making, but they're the ones being relied on to solve it. In this case, it's a little bit different. This isn't a crisis of anyone's making. This isn't a crisis that you're being expected to solve. It's not a fire. It's not you closing a site down. It's not a localised health crisis in one of your developments or sites. So it does have a few key differences. So your audience here is both, there is an external element through the press, but largely your audience here is not informing the wider public. Your audience here is your staff, your residents, tenants and families. The press is at the moment certainly a less of a priority than it would otherwise be in a crisis. So thinking about who that audience is and really focusing on that, and that's I think the key thing to think about right from the beginning. Thinking about the resources you have at your disposal, and I mean that in the broadest sense. So thinking about what information you have about your organisation and how it's approaching the problem, what processes you have, what staff resources you have in reality at the moment, and I know that's a particular challenge as well as what staff you have to deliver some of your communications messages. The families of your residents can be considered a resource in this case as well. For the more traditional stuff, what is your website like at the moment? How capable is that of delivering rolling messages and key messages to your audiences? What's your social media channels like at the moment? Do you have good contacts in print media? Do you have templates that can be used for sending things to people, and how are you going to go about doing that? Do you have any other digital resources that you can bring to mind? What's your resources like in the communities that you operate in? Are there groups there that you've got relationships with that can help deliver messages for you if you're unable to do it directly in a way that we might previously have done? If it does come to it, do you have people who are capable of speaking to residents or tenants or staff in this kind of format, who are comfortable doing webinars or video conferences? Do you have people who can do broadcast media if that's required down the line? So knowing all of those things and gathering them all together. Then it's important to look at your channels, just kind of covered a little bit under resources, but then what is it you want to say? What's the proactive thing that you want to do and say to your audiences? Is it to provide them an update on services? Is it to tell them about equipment that's available? Is it to give them advice? Is it to signpost them to other things? So even though we're in the middle of this crisis, those kind of pause moments are still something you should be constantly referring back to where you can. Moving on to talk about the timing of when you communicate. In a standard crisis communications, if it's something that you're responsible for, I would usually be saying that you need to be proactive, which is true, and it's still the case here, but I've changed the wording slightly to timing. So think about when is the right time to engage with your audiences. What is it you know? When do you have real firm information? What is it you don't know? What are you planning to do? What are the risks? And how can people help, both in an operational and in a communications sense? So when is the right time to talk to people? You've got lots of partners here that can help you with that. As I said at the beginning, this isn't your crisis to solve, so you're not alone. Reach out to other people who can help you wherever you can, whether that's the local health services or whether that is other partners. Moving on to tone, I've put a picture of Gordon Brown there just for being kind of quiet and boring, I guess, in his delivery of speeches, but that reassuring tone of being empathetic and understanding and clear with what it is you're trying to say, what's the action you're taking. People want reassurance through the information, through the action you're going to take, what you're trying to achieve by that, the timescales under which you're trying to achieve them, and also what it is you don't know, where your lack of assurance, where you don't know things, and be honest about what you don't know. People don't mind you saying I don't know, as long as it feels reasonable. I should probably just have termed that everything that Boris Johnson's not doing at the moment. Be very consistent, and I really should have termed that what Boris Johnson's not doing. Be consistent with what you're trying to say and don't overpromise. So only promise what you feel it is you can deliver. If you've got a problem like we can't provide a certain thing or we can't do this, say that. We can't provide a certain thing, but we're trying to find others who can. We're trying to provide this. Do you know anyone who can help us do that? So reach out and really use that network that I talked about at the beginning. And during that kind of inconsistency of and under consistency, also think about, is there a consistent time you should be speaking to people? When are people expecting to hear from you? If you begin a kind of rhythm of speaking to all residents, for example, try and do it at roughly the same time of day, so there's an expectation of communication or an update coming to them in some way as well. Moving on, I'm afraid, so that's kind of the basics of some crisis communications. That largely applies to all crises, with a couple of little kind of caveats that I talked about. I think here we're just going to talk about what some of the stuff is that's coming next. I know you'll probably already been finding some of these problems, and as well as some of the solutions, and the solutions are critical, and I'll come on to that later on. Some associations will have people who are just hard to reach geographically. They're just far out and you can't get to them, either directly, obviously, with restrictions at the moment, or with technology, or just due to staff resources. Even in inner city areas, you might not be able to get to people you were otherwise very able to contact. So it's finding solutions and realizing that is a problem. How do you reach out to those people? And how do you get information, even the most basic information, to them in a circumstance when information is being updated on practically an hourly basis, and it is indeed in many ways contradictory, because they're going to look for that information from somewhere else. To do that, you need to look back into your community. I think even if you've got staff who are off at the moment or isolating and who are not considered key for some reason, or have developed symptoms, they're still going to want to help you in some way if they can. They're going to want to help residents, they're going to want to help their community, and I think that's one of the key strengths that housing associations and indeed others in third sector organisations actually have. So those community connections, either using the ones you've already got or finding them, people are going to be on your side. And again, this is one of the slight differences to a standard crisis where people might be against you because they'll blame you. People are on your side. They want you to succeed, they want to help, and they want to do things that are going to help people in their local area in particular. If you're getting things like that, capture it. Don't just kind of capture it and use it for the future, because those contacts are going to be critical in what is a long-term game here. We're going to be doing this or versions of this for months to come, I think is fair to say. So those people are going to be critical, not just on a one-off basis, but find out who they are, what they know. Social and digital, you knew it was coming. Social and digital are going to be absolutely centre of what you're trying to do here. Look at Facebook in particular to share information. There's already so much misinformation on Facebook. There's a whole bunch of local groups that are setting themselves up to try and help. If you've got a particularly hard to reach development, hunt around in the local area of local Facebook groups and just post things through your official channels and say, look, do you know anyone? Or get someone local in the area to post, we're trying to do this, can you help us? There are people out there who really want to help, and Facebook in particular is a really good audience for this. It's not a platform, again, you would usually use much for crisis communications response, because it tends to be a bit slower and not quite as reactive as getting things out like something like Twitter. But for this, where it's a contacts you're trying to make and networks you're trying to build, it really is going to be very important. So use your social media channels, target those hard to hit areas, and really try and build the connections that you're going to need. I would also say, don't forget about traditional media. This is not just about pushing digital and social as being the be-all and end-all. It's absolutely not. In a lot of local communities, local newspapers are trying to do a lot more than they would. They're taking on a very public service role in a way that they had been trying to do previously and were struggling because no one was buying them. They're looking for ways to get message out to their local communities. So get in touch with your local newspapers. Say, look, we've got this problem. Do you know anyone? Is there ways that you're trying to reach people? They're acting, certainly in some areas, I know they're acting as little hubs of community and social information to try and help people as well. Certainly, I know that a lot of the local newspapers had messages out last week saying that they're on their front pages everywhere that they're here to help. So you look at those channels as well. But social and digital are definitely going to grow in importance over time. So there is an opportunity here to make those connections. Moving on to the next phase is a little something a bit more practical. I think there's I think it's fair to say this is going to get worse before it gets better. So there is a chance here to gather some information for what's going to be the public next stage of this. Gather information now about what's going on in your developments, what the situation is, what your staffing levels are, what actions are being taken, and have all that ready. Facts, facts, and facts are going to be absolutely centre to what happens next. If you can, look at some scenarios that might come up. And this is how, when we do crisis communications training for any organisation, we basically take their worst nightmare and pile it on top of 3 more worst nightmares and see how they react. So when you come up with some scenarios and look at what would happen if it was that development, what would happen if that happened. And I think the thing that's probably going to come out shortly or soon is going to be where there's clusters of cases or even clusters of deaths at particular concentrated areas, and housing associations are obviously going to be one of the possible areas where that could happen inside a development, inside a block of flats, just in a local area centred upon a housing association site. And that obviously has both short-term ramifications, obviously, but long-term reputational ramifications for your organisation. So it's important to manage those kind of individual crises as though they were affecting the entire whole organisation. So where you can, plan for those scenarios. Also, just now, you need to be planning for what your communications channels are in the event that you become the centre of a negative story around COVID-19 in the near future. So for that, you need to know who is the spokesperson, who's the person that's going to front this if something happens. What are the channels for getting things approved by senior management if something bad happens at a particular development? Is your website capable of switching over quickly to handle media calls and provide information if that's required? Do you have templates ready for social media posts, for any posters and newsletters you can put up in the local area for your website? Are those ready to go? Do you have those contacts at local newspapers for who you will call right away if something bad is happening at one development or one site in particular? Having that kind of information ready in advance is absolutely going to be central to trying to get over a next phase of this crisis that involves clusters of cases in particular areas. The good news, I guess, is that the story will at some point move on. There is already, we're seeing it already this week, that there's already stories about how people are coping and what help is needed. So we're at the stage of people are struggling with this and we need this kind of help, and you're seeing that both to government and elsewhere. It's not crass and it's not out of order to start lobbying for things, to be speaking to politicians and saying, look, we need this thing, we need this thing, and we need this thing. What are the things that you need that would actually help you, even just a tiny bit that would help your residents and your staff? And again, work with the local community groups. Is there something that would help them be able to get out? Are there contacts that you can help them with? So there might be community groups who are trying to access sources of, I don't know, it might be sources of food or things like that for the local community. Get involved in those kind of discussions and those kind of partnerships. You guys are absolutely part of the community in the areas that you operate in. People will look to you to maybe make those links. It really is everyone in this together and everyone trying to help. The next stage that the media will start to look for is solving. There will be solutions found out there, and again, we've found this with some of our housing clients, our private housing clients and hospitality clients, where they're doing things like giving over hotel space, they're offering up homes to be used for NHS workers. This is a kind of a positive story the press are going to start looking for. So where are the solutions? Where are the things we're solving, not just coping? Where are we actually making life a little bit better? There will be some, I know for a fact, there will be some in every single one of your organisations where you can talk about what is happening at one particular site, where members of staff are going above and beyond, where developments are working together really well, where residents are doing particular things either to help their local area or to help other people, other of your tenants. That engagement is going to have a lasting impact. That kind of, that your role and the role you play now in the local community and the role your staff and residents play are going to have an absolute lasting legacy on how you are thought of once this all ends. We're seeing this mainly obviously in the private sector at the moment with companies like Wetherspoons not behaving themselves, and I think there will be knock-ons for those companies when this is all over. I think the public will remember that. And similarly for organisations like housing associations, the public are going to remember the good things that you do. Next bit, sorry, I ran out of pictures here slightly, so I do apologise for suddenly not being pictures behind the words. This, like any crisis, it exposes every single weakness. It's just everything gets laid open. All the things that you thought weren't a priority, that wouldn't matter, that didn't matter, all of a sudden become the primary thing. And that can be something as simple as, are people able to work from home? How much are they able to work from home? How comfortable are your staff? Is everyone on the same IT system? It can be that simple. But I'm afraid we're just going to have to kind of learn all those lessons as you go. I do know from experience across all types of sectors that all the times that communications teams and departments and heads said, that person's really hard to reach, we can't do that. And the solution was kind of palmed off as not a priority, it doesn't matter, we don't need that technology, we'll never have to do that. all those times that was ignored, it's about to be listened to, and it's about to be listened to very quickly. And as I say, because this isn't your crisis to solve, the communications teams are going to be at absolute heart of it. You're the conduit for other people's information for the large part here. You're the person who's getting out what's going on in the local area, what the official government advice is, what people should be doing. It's not for you to decide that, it's for you to communicate that. So it is going to show up all those weak spots. Where you can, try and solve those problems just on the hoof. I think communications professionals are one of the groups of people that are really good at coming up with creative solutions to problems like that, off the cuff. We'll try that, let's see if it works. Where you try things, capture it, that worked. If that worked in one area now, it will work in another area later, both during and after the crisis. And mix the high tech and the low tech. Use social media, use digital, but sometimes it can be as simple as getting a community group on Facebook, getting someone saying, look, you're allowed out to go shopping. When you go shopping, can you post this thing on a wall somewhere for me? Can you put this through a door for me? Can you put this up in a development, outside, so it's obviously got to be safe. That can be as low tech as it has to be. It could be something as giving someone a phone number to phone. So keep that in mind. It's not all. This isn't about saving the world. This is about doing little things that really make a big difference. Secondly, there's going to be an element of this though where you are compelled to use digital as we are now. You can't have tenants meetings. Distribution of newsletters is not effective at the moment because the information is changing so wildly and because postal services are not exactly going to be up to scratch for a while. So information can't arrive 3 days late in many cases. We need to try and do things as up to date as we can. So it's going to be critical either using social media or digital channels that you either already have or that you want to create. So don't be afraid to try out new things. So you might, and I think in a number of organisations you've probably been telling various people that you need to start moving to digital tech now. This is going to show that you're right about it. So it's about trying to build that infrastructure for what you need to do it in the future, both the physical infrastructure, if you like, in terms of accounts, but also looking at who's going to run these things, what's the processes you're going to use, who are you going to reach out to help you and properly engage with. And I think lastly, this entire thing, I think for all of us, this isn't just related to comms, the shifting of expectations of staff, residents, tenants, customers, individuals, just obviously people who are working for me at the moment, they're going to shift massively. They're suddenly all the things that everyone was told couldn't be done. It turns out have been done really quickly. We can't work from home. Oh, we have to. Well, here's a laptop, and everyone's kind of figuring it out. And I think across all age groups for housing associations, things like digital comms are going to suddenly become an expectation. It's not going to become just something to do. It's going to be something they're going to expect. I think even more broadly than that, the kind of tone you use now of really clear, direct information, really factual stuff, and speaking directly to them on an ongoing basis is an expectation that's going to be created as well. They're going to expect to hear from you more. They're going to expect you to be much more communicative than perhaps they wanted in the past. That's not a criticism of not communicating. Many people didn't want that before. I think you're going to see that being an expectation in the future, and there's no going back. And I think that's true again for a lot of policy changes that are being made around things like universal credit. Again, things we were told that couldn't happen. We couldn't do that, change universal credit. We couldn't use houses for homeless people. It turns out we can. And I think that this expectation during the crisis of regular, honest, forthright information is going to be around for years and decades. So whatever you do now, I think you're creating a new expectation amongst your staff and amongst your tenants. Some of this is kind of capturing things I just talked about, but I think there's a need here for creative solutions. Look at how, so even if you're not the kind of central control the comms teams, and I'm one of them, loves to have, is going to go, you're going to have to audit how information is actually getting to people at some point. How is that person in that development finding out that thing? Once you know that, write it down, massive spreadsheet, just think that's how that happened, because that's the thing you're going to need to do afterwards, because that's going to be that expectation being created. Always try and give people a kind of a permissive culture, I guess, to try things out. If they don't work, stop doing them. If they do work, embed them and capture it. But it's going to be absolutely important. It's going to be really important to make sure that people feel they can try things. If that's your local staff and they know they just have to be allowed to do it, which does give up a bit of control, which can be a bit uncomfortable. But we need to make sure that we need to find out what works, and when it works, it should just be allowed to stick. So that getting that kind of permissive culture out there is going to be really important. As I say, think infrastructure, think how you're going to do this, think channels, and think process for the future as well. So you've done it one way, you're going to capture all this information, and then you're going to think, what's the infrastructure I need to deliver that new thing, because the communications is going to change entirely in the most general sense and specifically for organizations. And finally, my session I was meant to be doing at the communications conference last week was obviously on digital shift services. So this presentation has been very different what I was going to give there. Obviously, the way to tie it together a little bit is that for that session I was going to talk about the experience that Orbit have had in digital shift of services, and that was services I meant like paying your rent, reporting repairs, and kind of more operational stuff. I really believe that communications in organizations will become a service that will have a digital shift, that people will expect to log on to a website, to something, and say, I want to know the latest information. And that will have to be updated regularly. They will now expect to go to a portal, pay their rent, do this, and find out the latest information as well. So for looking much further down the line to the future, if you're designing new websites or services, remember what you're doing now, and remember how to embed that into what you're going to do in the future. I think I went much longer than I was planning to there, my apologies, but that's me finished there. Just for the SFHA people, I can't see the questions at the moment, I don't think, so apologies. Aha, I can now, there we go. Right, I think I've no idea who can hear me and who can't, so I think I've got SFHA teams are on mute at the moment. Do you want me just to keep talking and do some of these questions as we go?
Yes, please, Graeme, that would be fab.
Okay,
I can hear you and see you, so okay, yes,
thank
please.
You. That was good. So I've got some questions here. Can we expect just for copies of the slides? Yeah, I'm happy to share that, and I'm happy to share it with the notes that I've got on the bottom of the presentation as well, if they make any sense. Just scrolling down, I've got a question. Is it ever appropriate at times like this to use communication to spread good news and positivity? Absolutely, do lots of that. I think the good news stories we need to collect are going to be important. I think people need to know that they're not alone here. You know, there's other people in the same situation, and those problems are being solved. And definitely use social media to share GIFs or memes. Yeah, why not? I love a GIF. Anything that I think works. It's only going to work with some audiences, but I think for the audience it works with, absolutely try anything. I think I say try anything and find out if it sticks. If it sticks, keep doing it. How do we make sure all teams are giving the same message to tenants when we're working remotely? That's difficult. I think you can put in some guidance into a kind of a larger theme. So I think an internal bit of communication with staff about this is our overall key messages. This is the things we want to do. We want to reassure them of this. We want to tell them this and this. You've also, as I say, got to be a little bit permissive with staff locally and trust them to engage with tenants that they know best. That is really uncomfortable to do, I know, but it's the only way. There's not a button you can press to implant this information into everyone's mind. So it's keeping the staff up to date with what you're saying, what your latest thing is, and also encouraging them to get back to you. I think that's the other important thing. So they say, what are the concerns that staff are having? That residents or tenants are having, customers are having. What are they telling you? So if you suddenly get people asking about a particular problem, you can then share that and put it out there as well. So it's about making that little feedback loop. How to contact us? I think I put the email address on the end of the presentation, but our web address is orbit.scot, and my email address is graham.downey@orbit.scot. Encouraging tenants to sign up to our channel so we can increase reach. That's where I think your community people really come into their own. Even just the kind of the note I was talking about getting put up on a wall nearby or outside, just saying call this number. So your communications doesn't have to be here's all the information. It can just be where's the hub you need to go to for information. So something that can work quite well is having a rolling Q&A on your website that is just constantly updated once a day. At 2 o'clock every day, that gets updated. Your website /COVID. And all you do is you put that, however you can, you get that out to residents that that's the website. That's what they need to look at. or that's the number to phone, or whatever else. And it's just about making it one thing that they can just check into all the time. But that's really is the trick. How do you get them to sign up for the one thing that means they get everything else? So you're not going to have to send everything out to everybody. And some kind of central hub or portal is going to be key for that. How do you prevent staff from sharing personal views? You can't. That's the absolute long and short. You can't stop staff sharing personal views, and you don't want to. What you've got to try and do, and this again the same in any crisis, you want to make yourselves the central point of information. So you want them to come to you with problems first. That's the only way you can try and have any control over what's being said and what's happening. So I think if you do see that, you can prevent them sharing it, and actually neither should you, because then it comes across as controlling, and then they're less likely to want to help you and go above and beyond, which is what we're all going to need. Where you see them, pick up the phone and ask them, say, look, we saw that, no trouble at all. We just want to know, how do you think we can solve it? And have a conversation, explain it to them with what's going on. But I'm afraid you can't prevent them actually doing that. And I say it's actually not a good thing to prevent them doing that, because it demotivates and makes them feel like they're being kind of centrally controlled, and you need them to have that a little bit of freedom to solve the problems you need them to solve. I think that's me done with the questions. Is there anything else anyone would like to ask? We're actually on time, which is novel.
Graeme, that was fantastic. Thank you very much indeed. And we really appreciate you being our guinea pig for our first webinar. So thank you for being brave. And I want to thank everybody who took part. We really appreciate it. We'll send a copy of the slides, as Graeme said, to everyone. We'll have those available. And we are planning to do a number of other webinars around different subject matters and for different particular groups within the housing associations. So thanks everyone again. And we look forward to seeing you either in person or virtually as soon as we can. Keep safe, everybody. Thank you.
Thanks so much.